Hello everyone, it's Wasim Irshad from Wow Health. I'm really thankful to CXO Global Forum for arranging all this health tech summit and then putting all these efforts together so that people can share how healthcare can be transformed. So I will take this opportunity. I will first of all introduce myself. I'm Wasim Irshad, CEO of Wow Health Solutions. So I also during my today's talk, I'll just talk about briefly about the healthcare situation in Pakistan, how digital healthcare can help out this health to sustain this healthcare system, and then our two primary services, that is about second opinion and how we can help corporates to improve healthcare of their employees. Let me start formally with my today's talk. Guys, when we talk about healthcare in Pakistan, the situation is not very good. Yeah, if we just look at our infrastructure, there is one BHU, basic health units, which are in every district of Pakistan, one BHU per 40,000 people. And as per UN Sustainable Development Goals, we need to have one BHU per 5,000 people. So, this gap is huge. And then if you just have a look at doctor to patient ratio overall in Pakistan, that is one doctor per 1,664 people, which should be one doctor per 500 people as per UN Sustainable Development Goals. This gap is ever increasing. And then if you just talk about the rural areas, then the patient to doctor ratio that increases to 1 ratio 4,327 people. So this gap is ever increasing. Why this is ever increasing? Because the number of doctors which we are producing right now, and then if you just minus the female doctors which are not practicing, and then the people, the brain drain that goes out of Pakistan, then we are remain with very less workforce. And if population keeps increasing in the same way, and we keep on producing same number of doctors, this gap will ever be increasing gap, right? So how this gap can be minimized, you know in Pakistan, I'm really thankful to all market players, Oladoc, MedIQ, Sehat Kahani, Marham, Meds and more, and all of these fellow peers. These all are contributing a lot to increase this awareness and understanding in the general public, that how telemedicine can help to bridge this whole gap, and why telemedicine is a very reliable source of seeking healthcare. So I also I see, if I just mention some stats, you see there has been reported 900% post COVID growth in telemedicine across the world. So people are adopting technology. People are, they need this gap to be bridged, and the organizations are working. We just have to put more effort on the awareness rather than seeking business. Only this way we can support this healthcare system. If we talk about Wow Health, just briefly, Wow Health started its journey back in 2018 in US, and Alhamdulillah, we have got a very vast network of medical providers in US. We have got 350,000 plus medical providers. We have got 5,000 plus surgical centers, 1,000 plus imaging centers, 100,000 plus eye clinics, and then 250,000 plus dental clinics. 65,000 pharmacies are on our panel across US, and people can just come to our website and find out the nearest pharmacy and get their medicine delivered to them. Similarly, if you talk about mental health services in US, we are offering teletherapy services in all states. On average, we have got 8 to 10 therapists in every state. So, keeping this whole bridge, and this is what, and we are providing 24/7 urgent care there as well. So during this journey in US, we have learned a lot, we have improved a lot, and we have built a lot. So when from founders from Pakistan, if you being Pakistanis, the next big step is to contribute to bring all that infra and to contribute all those efforts to Pakistan. So we recently we are not very old company in Pakistan. It's been just a year. We launched our operations in Pakistan, and we have got a very good network of 800 labs and 200 plus pharmacies, 1,000 plus specialists. We are operating in across all seven cities. We are partnered with some good names like WADA, like Planet and like we are partnering with Chuktai Lab. We are partnering with Excel Labs. Some good names. So my today's focus will be uh, more toward the gap which is existing in this Pakistan's domain. You must have heard about second opinion in medical. This is quite a known terminology, and people are using second opinion. Generally, if you see in our daily life, if we are diagnosed with anything, Khuda na khasta, with any of the major illnesses, so we are never satisfied with one doctor. We just want to ask another doctor. We want to take another opinion, because then we feel sure about what have been diagnosed is the right diagnosis. Also, we sometimes we don't know that whether the treatment is available across the globe or not, right? So we also need to seek opinion that whether the disease can be treated out of Pakistan or not. If you just have a look at the diagnosis across the world, Mayo Clinic, it mentions in their research that only 12% diagnoses were diagnosed correctly, and then 20% people were misdiagnosed, and 66% were, there were some initial changes in their initial diagnosis, right? So that's a huge number. If you just look at US, 12 million people were affected by wrong diagnosis, right? So if disease is not the root cause is not found, then we don't we can't expect that the treatment is going to be right. And this volume of second opinion is increasing day by day. The industry of second opinion, it increased from $2 billion back in 2019 pre COVID to $7 billion. It is expected to reach to $7 billion by 2024. So second opinion is one of the ways to reach to right root cause of the problem across the world. Wow Health, having the largest pool of specialists, 350,000 specialists in US, we are leveraging our doctors to Pakistani people. We seriously feel that there is a huge gap. There is a serious group of people who have been diagnosed with some critical problems, or they are suffering through some prolonged illness. They want to seek second opinion from out of country. Wow Health, we have leveraged our network, and we have made the cost so affordable that each and every one in Pakistan, in every corner of Pakistan, can seek that service and use all those specialities. We are offering 70 plus specialities, which includes oncology, which includes cardiology, dermatology, neurology, infectious diseases, urology, pulmonology, radiology problems, and then obstetric and gynecology problems, pediatric problems. So we have got a huge, wide range of specialists over there. We have focused on make two things. Number one, that we bring the cost lower, so that everyone can afford it. And second thing is that we make this experience so simple and so easy that people having the smartphone, people not having the smartphone, the tech savvy people, or with people who are not into technology much, they can seek that second opinion very easy and comfortably. Similarly, how this whole thing works. If we just talk about how this works, the process is very simple. You just go to our website, book a second opinion appointment, and then our helpline will get connected with you. We will collect all of your case history. Our doctors will evaluate that case history. They will let you know. Our doctor in Pakistan, they will let you know that if you need to any other tests to be done, and then these all history this case is made and electronically shared via secure channel with our US doctors who evaluate all that case. And there is a complete portal of to and forth communication where they keep telling us that whatever they need, if they need to need some other tests to be done, other labs to be done, anything, or any questions from the patient, we ask that we get those tests done from the home. Our teams go to your home, they get all those tests done, and then this whole case, we receive a complete summary of this case, right? This summary includes a complete folder, hard copy, that includes a summary from our Pakistani doctor, a complete diagnosis written by the US doctor, signed and in original. And then we also add the profile of the doctor who has written that whole diagnosis with along with his link. So you get all that folder, you can take it to your doctor, you can take it to your surgeon, so that they can also be assisted with this. I have myself tested this service. My niece is suffering right now even, and one of our directors, their family member is suffering, and we are very much satisfied. Our customers are very much satisfied for all complicated kind of issues. And I will just say that the price range is very simple. If you just go to any doctor within Pakistan, you specialist, you just pay uh, you know uh, 3,000 to 5,000 for a good consultation, right? We are trying to keep this close to this if you just pay double than this, and you can seek a complete US consultation. Wow US also has got US general physicians where you can connect with them on the video call, and just seek your basic assessment on your health. That the process is same, simple. Just call on our helpline number or go to our app, book appointment, and that's all you need to do. When we talk about second opinion, this is coupled with all other services as well. What are other services which Wow Health offers? You can talk to our GP doctors within Pakistan 24/7. There are two ways to seek that service. You can just call on our helpline or use our app to book appointment, or you can move to the pharmacy and buy our scratch card, 40 doctor card, where which you can keep in your pocket. If you just have a look at the Pakistani domain, your basic problems, your temperature, diarrhea, allergies, basic headaches, the smallest problems, we have to go to doctor. You have to leave your office, you go to home, take your parent to the doctor, get checked, or take your kid to the doctor, get checked. So why not? The concept is that why not we just pick up the phone, call the doctor, get the basic prescription done. Vowelt is also offering doctor at home services. We are offering lab discounts along with the home sampling across Pakistan. We are also offering some of your medicine deliveries in specific cities. So what we believe is we are collaborating with lots of other providers so that we can provide end-to-end experience. We must understand this thing, that in Pakistan the least bothered thing is customer care. What we focus on is the customer care, because our customers don't even know this thing, that they have to be cared. They are customers, right? If you want to talk to doctor, you should be connected to the doctor right away, right? Similarly, if you need home sampling to be done, it should be done right away. So you can call Wow Health as a complete virtual clinic. Guys, what I would want to talk about, the next important thing is how we are helping employers to to help their employees in generally in their how they seek their healthcare. In Pakistan, if you talk about uh, you know uh, if you just talk about healthcare, so how there are insurance companies which generally offer healthcare to the patients. Now, these insurance companies, what generally they do, that they charge you a premium for the prolonged, or major illnesses. If you get hospitalized, they are going to help you out in that. But if you talk about the younger population, you see most of times you just end up in OPD services. You just go to OPD services. You just talk to doctor, for you just visit to doctor for your basic needs, your routine care needs, right? In this, for this just routine care needs, when we talk about routine care, uh, we are we talk about routine care needs. So what includes in routine care needs? Your telemedicine sessions, your lab discounts, your free home sampling, your medicine discounts, your doctor at home, and your second opinion. All these services packaged in one package, right? So what you pay starting from just 1,500 rupees per employee per month, and what you get is you get all these services. If you talk about OPD expenses, generally they are paid out of pocket, right? And these out of pocket expenses, these are, for example, if you have a company of 50 people and you can create OPD pool of like 300,000 people, right? And these 300, 300,000 rupees, these 300,000 rupees will be paid as per actual needs by the insurance companies to your employees. We serve as a gatekeeper, right? So whenever you need, you just don't, your employees don't end up to specialists all the time. They just call to our telemedicine service. They seek that service, and most of their problems are solved by our doctors. And once these problems are solved, then after that, if specialist visit is needed, we arrange that. We can book it for you. If any tests are needed, we can book it for you. If medicine delivery is needed, we can book it for you. So this is something really value added services. If you talk about being an employer, we being tech people, we have to come up to the modernized solutions to help our employees. The smaller employers, who can't afford huge premiums, we have got packages for them which are very affordable, very cost efficient, and and the seeking service is very easy. Everything is done at your doorstep. So it is, you pay less and it's more convenient. So the virtue of CXO Global Forum, I would want everyone to try at least second opinion service for once, for anybody who know is suffering through the critical illness. Just try it once. It's amazing service. If you are employer, just go to our website and drop us an email, and we will get connected with you, and we'll offer you one of the very convenient healthcare package for your employees. I think that's all for today from my side. If you have any questions, you can post in the comments of this video so that I can answer to those. Thank you so much for your time.